our own practice so far in adult infectious diseases, about 3/4 of the patients we've sent out tests this year are immunocompromised, either solely organs or hematologic malignancies. A few patients in our own experience were HIV patients, but also we consider the ideal patients to be patients at high risk for infection, where a pretest probability is pretty high, and then we can use sometimes case triggers. And I know this is just a list, to think about this test. But to think about, patients where the standard of care testing is just limited, or we cannot, or we more commonly, actually, we just don't have available invasive testing because of contraindications, because of limited access. Um, Also, to think about, when we're considering organisms that are fastidious. I live we are here in the Midwest. We do have a high rural population, so we sometimes will think about, things like this, rat fever. We'll think about tularemia, and others. So we sometimes, and we actually diagnose patients. Well, no, with BAL, we use in Karius spectrum, but not to take away the role of traditional testing with serology and blood-based testing in cultures. But definitely one thing that Dr. Fernandez had already alluded to is the fact that the test, it's quite rapid. It is an advantage, especially in our high-risk populations and immunosuppressed patients, when you're able to actually get an answer quick, to make decisions quick. And we don't know yet if we are making a difference, but I do presume and do think that we probably are making a huge difference by early detection and making a positive impact in our patients' care.